actually on the payroll and who are actually working. So we're trying to eliminate the sending of the money to the various councils for onward payments to the council. So there was a transitionary period for that. And so that once that is addressed, they won't have any challenges going forward. They'll be treated as salaried workers as we normally do with the other section of the NEP. So that's the issue there. The issue, and that's what, while I'm on this, Carla, if you allow me, I just wanted to speak to the issue of the new salary structure for the public service. As announced by the Minister of Finance in the 2023-2024 budget, the government of Dominica has approved recommendations coming from the completed organizational review on reclassification of the public service. So I am pleased to announce that as of this month, September, the new salary structure approved by the Cabinet will come into effect. Under the new structure, salaries for employees at all levels will be increased, with the exception of level 1, which remains unchanged. This means that just over 2,940 public officers will benefit from the new salary structure in the first phase, resulting in an overall increase of 6%, with some public officers benefiting from up to 13% increase in salaries. This will result in an increase in the government wage bill by an estimated $9 million annually. So the question of who will benefit as of this September by this new measure, we are talking about many of our essential service providers, our teachers and principals, public police officers, fire officers, doctors, nurses, environmental health officers, and others who serve on the front line of the public sector, providing key services to members of the public at critical times. And so I am pleased to announce that from this month end, these public officers and their families will be better off and better able to take care of their commitments. Again, this reflects the government's policy to do all it can, even in a difficult economic period, to improve the lives of all our citizens. And so the question of the national debt, as it stands now, it's about 100% of GDP, and it's going down as the economy grows and you reduce on your debt. Then they certainly will see a reduction of this, and so forth. So that's where it stands. The issue of packages and the post office the world over are having challenges. They were created in a particular time, and time has changed in a dramatic manner. Okay, and I know that the post office have had discussions with their international partners on how they can reposition themselves in the new dispensation to allow them to be able to provide new and added services to the public and so forth. So I think it's work in progress, and they have to refocus themselves, because the reality is most of us don't write letters anymore, and therefore delivering mails to you is now a historical issue, and so forth. But it is something that we have to look at. This is where I believe the private sector entities can come in, because really and truly this new dispensation requires more private sector such services. There are some locals doing it, and I think that we need to expand on it so that those services can really be done by private sector entities. I've just been advised that I should, in the public officers will be affected in terms of the salary increases, that customs officers, and inland revenue officers will benefit as well. So a significant number of public officers, and I know that the public servants have been working all weekend with the Treasury to ensure that all of the administrative matters are put in place, so that come this September, that the salaries can in fact reflect an increase in so forth, in the salaries and so forth. Yeah, Carla, I'm sorry, Matt, please.
Yes, Mr. There's a lot of concern, and I just want to read from a question you sent to me, that the Dominican economy is facing some challenges. And the sources reveals that very soon, public officers, and you just mentioned, I'm
Mm-hmm.
happy to hear, may not be able to be paid. And the health system is falling apart, NEP workers not being able to get paid, Dominican travelers to the UK experiencing unusual scrutiny, CBI funding projects are experiencing financial difficulties. It's also a comment here that Mr. Vince Anderson, who seemed to have been targeted to succeed the Prime Minister, seemed to have been falling out of favor at this time, and he's not even allowed to act as Prime Minister. Any comments on those comments there?
Sure. The the issue of the challenges that Dominica faces is no different from the rest of the world. Um, you come from two major natural disasters, 2015, 2017. Then when you overcoming those, the COVID-19 came in for about 2 or 3 years. Then here comes the Russia-Ukraine war. The government has had to subsidize and to cushion the impact of the rising cost of energy and food supplies to the country. We have not introduced any new taxes, rather we have reduced some taxes in the country. We continue to ensure that we provide for the less fortunate among us and to provide support to the private sector in advancing economic efforts in the country, whether it's through hotel construction or the purchase of businesses and expansion of businesses, whether it is to provide additional space for Clare Harbour in Portsmouth to provide employment opportunities, and they're now looking for an additional 200 people to be employed on top of the 300 that they currently have. Whether it is to purchase Domlec so that the government now can work with Domlec to acquire additional assets and ensure that it can cushion the impact of increased energy to the public. Right? Talking about increasing the tax threshold, the VAT threshold from 100 kilowatt units to 150, and also removing VAT on fuel surcharge, and all of these things are recurrent revenue reductions, and so forth. And you're talking about increasing staff at the Dominica China Friendship Hospital to ensure we provide better and improved care to people. The number of the doctors, we have, for example, for a country like Dominica, to have 4 orthopedic surgeons employed is way too much per capita. To have 4 gynecologists employed is way too many for our population, and taking into consideration the number of births in our country. But we have those there employed. People don't talk about those things. You were talking about more fire officers, more police officers. We have about 50 or so special constables employed to provide additional support to the police because of the increased demand on the police and so forth. So you can go on and on of the number of areas. What is the allowance for 65 and over, or assisting students to study overseas, or road improvements, housing construction, whatever it is, you can name it. You have those issues there that you have to address. You heard from the Minister for Health about the health system. I mean, I believe that the health professionals, and I've said so to them privately, and I'll say so publicly, that they have to defend themselves. Because the criticisms I'm hearing from the public, it has to do with the delivery of healthcare services. And so it is left to them to stand up and say, well, what you guys saying about us is not true. And I don't think it is true. We all have had family members who go to the hospitals and health clinics and receive the care and generally, by and large, people get good service at the hospital. We have the best medical facilities that we had in our entire history. We have more specialist doctors at the disposal of Dominicans than we had in every time of our history. We have more equipment and diagnostic services any time in our history. To say that the health services is crumbling is an unfair a malicious statement to make. And we have to be very careful that we don't put that in the minds of Dominican people who, when they get sick, will not want to go, while the rest of people who have access to other means will go and get it, and those who really need it will stay at their homes because of what people are saying that are not true about the health services. This is a dynamic system. Every time there is something that you need to improve, every time there will be a service that you need to look at. So it's a dynamic system. It's not static. It is fluid, and so forth. But we cannot go to the hospital and that one time we get a little stoops from a nurse, then we use that to categorize the entire delivery of healthcare services. I lived with a nurse for many years, and I know what nurses have to deal with to provide care to people. People used to come to home at 2 o'clock in the morning, 3 o'clock in the morning. So I understand that if a nurse is at the accident and emergency and she's seeing people all day long and everybody believes that his or her issue is the most urgent, of course the nurse is going to get a little bit grumpy. Of course they're going to get a little anxious and frustrated. And of course the nurse may say something to you that ordinarily he or she may not say to you. But for us to say that the place is crumbled, we talk about there are no supplies at the hospital. When I speak to CMS, they say no, there is the issue of a particular suture that they need, that they have other supplies or such, but there's a particular one that they may not have, but they have others. You may have 5 different medications that you can prescribe to a patient, but the one the doctor may prescribe may not be available. But there are 4 others that you can prescribe. And I think what we need to do is to find a way of having this on the system so a doctor can go on the system and to see what is available and prescribe a medication. So it's a matter of we having to work to make something work. Because I mean, at the end of the day, even if we have health insurance, we first must go to Dominica before we are sent by ambulance out of Dominica. So let us not curse the candle in the darkness, rather than praising it and thanking it. And so we have to be very careful that we don't put in the minds of our people. We made tremendous progress with the help of international partners. And when you compare the Dominica China Friendship Hospital now to what the PMH was some years ago, it's the chalk and cheese. And we're not boasting, neither are we bringing on anybody, but there are not many places in the Caribbean you will see that quality of healthcare facility. You know, and the quality of medical professionals, the nurses. I mean, the nurses are extremely committed. We have a challenge, like every other country has, where nurses have been poached by larger countries. Who are we to compete with Her Majesty's Treasury? Or the U.S. Treasury in terms of being able to pay nurses and to things. And the reason why the UK is poaching nurses from us because the countries in the Middle East are poaching the nurses because they can pay them more. And that's what happened. It's a cycle that's going on. So they poach from the UK poach from us. And therefore we have to train. And this is why we're saying to the UK and Canada and the United States, well, help us train more so that if we train 10 and you take 2, it's okay. But all of his nurses we train them. There are many of them who we send to Jamaica to train, and we paid for that, and they get recruited by the UK. They figure it's a greener pasture, but they only go in there because the British people or the American people won't work in certain districts, and so they're available. But I just want to caution us against crying doom and gloom over a situation where there is no doom and gloom. Do we need to continue improving? Of course you need to improve. Unless we're dead, you will not have to. You'll not stop having to improve something. You know, you're only dead. But as long as you're on the earth, something will come up that you have to address and so forth. And rather than we making time to address it, I see there are people here and people overseas who are praying and hoping that the hospital will come to a halt. You know, and when I go to the hospital, I see them there. They're enjoying the service. Their family are enjoying the service. They don't send them anywhere else except the PMH. And so let us not look at the situation and chastise it and denigrate it when this really is unfortunate that we're doing that. You know, what is our motivation? And those who I hear criticizing and creating and calling doom and gloom, they have no sensible recommendations. They have no sensible recommendations. The CMS buys medication, it sells it to private doctors and private facilities, in some cases at cost. So when you buy stuff and you sell it, sometimes you don't have it. You may not have enough to think. And I've said to the Ministry of Health that the CMS is not involved in private sector engagement. It's a public sector facility. And its only mandate is to buy for the public health facilities. And the selling of stuff to other people outside of providing the hospitals and health centers should not be allowed. So that we do not run short or low in stock of anything in the country. And when it comes to healthcare, this government has been known to be the government of healthcare. We have transformed healthcare services in Normandy. You open the migrant hospital and they want to create a problem with it. As if we want it to remain closed indefinitely. Instead of saying, okay, well, yeah, let us start, let us roll, let us go. This is why I commend this doctor. What's his name? Dr. Elick. I met him sometime at the A&E. You know, great spirit. That's the spirit that we almost have. And the guy has been asked, can you go to Marigot to help? And he's graciously agreed to go. And even when people tell him he shouldn't go, he said, no, I want to go. I want to go to Marigot. So if nobody wants to go to Marigot, how are we going to provide the medical services to people of Marigot? And then because these things happen, we say it's doom and gloom. Because some doctors may not be happy with the terminal condition, we say doom and gloom. The nurses and doctors have been striking in the United Kingdom for the last year. For the last year, asking for improved conditions of work. And we have Caribbean people, nurses and doctors, going there to work. We have many parts of the United States where you don't have people who want to go and work as nurses and doctors because it's a dangerous neighborhood, or it's a black neighborhood, or it's an impoverished neighborhood, and people are not going to work there. And so they recruit us to come and work in those places. So let us speak truth to power, as some of you like to say. Let us speak truth to power. Is the system perfect? No. Do we have a utopian system? No. But do we have a system in crisis? No, we don't. We don't. So there's something I can talk about. I'd rather not talk about it publicly, about my observations and my concerns, and I share those with people who I meet. But I don't agree with that. The issue of the CBI projects and difficulties. Matt, there is an attempt by some in this country. I wanted to address this issue earlier, but I gave deference to the Dominic issue. But later this week I'll address it frontally. But there continues to be an attempt by some in this country to destroy the CBI. And so they are colluding with international journalists and some regional journalists to propagate a lot of mischief, misinformation about our program, all in an effort to destroy it. And some people are part of this in Dominican just because they want to get the Labour Party out of government. Now, when you get the Labour Party out of government, and God forbid you to come into government, and you destroy the CBI, what's going to happen? A program that underwrites a significant part of our economic and social development. A program that is underwriting the full cost of the National Employment Program. Close to $5 million every month. A program that has been used to build thousands of homes, improve healthcare, help with national security, help with diversifying the economy and growing the economy in agriculture and tourism.